Welcome to today's HealthLine webinar from the American Association of Kidney Patients, titled Stop the Itch, Understanding CKD-aP and Kidney Disease. Thank you for joining us today. My name is Jerome Bailey, and I am AAKP's Director of Patient Engagement and Advocacy, and I'm pleased to lead today's webinar in recognition of National Itch Day. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host webinars as part of our mission to empower fellow kidney patients, family members and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to available treatment options. At AAKP, we work to ensure that patients have a central role in the research and development process so that unmet needs are identified and unique patient insights and lived experiences fully inform innovation and the product development lifecycle. This includes clinical trials to regulatory action and payment decisions. Through our initiatives, we aim to make sure patients have a central voice in research and innovation. By leveraging lived experiences and unique insights from the kidney community, we help drive meaningful advancements across the entire product development lifecycle, from clinical trials and regulatory processes to payment decisions. As medical science progresses with personalized medicine, cutting-edge technologies, and novel treatments, the potential for better outcomes in kidney care has never been greater. As shared, today's program is part of AAKP's National Stop the Itch campaign, held in recognition of National Itch Day, observed annually June 3rd. Today's webinar features a discussion about understanding and managing chronic kidney disease-associated pruritus, or CKD-aP. CKD-aP is often a distressing and overlooked condition found primarily in people treated with hemodialysis. It too often goes undiagnosed or misdiagnosed by healthcare providers. Our medical speaker will discuss how CKD-aP is assessed and measured, why it is often misdiagnosed, common symptoms, and current treatments. We are also pleased to be joined by an AAKP International Ambassador who will share his experience with this condition. Before we get to our speakers, I'd like to take a few minutes to share some powerful insights we gathered from individuals like you ahead of today's event. Through AAKP's Center for Patient Research and Education, we conducted an independent flash survey to better understand what people living with CKD-aP are really going through and how it affects their daily lives. Let's take a look at what we've learned. We heard from a wide range of individuals on in-center hemodialysis. The results, a clear and compelling snapshot of real patient experiences. A large majority, 73%, said they've experienced itching in just the past 6 months. When asked to describe it, more than 70% indicated their itch ranged from moderate to severe. Over half of the respondents shared that their itching has a real impact on their daily lives, while nearly 1 in 3, 29% said their itch takes a toll on their mental health. When we asked if they've talked to a doctor about their itching, more than half said yes. This was a great statistic as it showed how patients are being proactive in their care. As for how people are managing their symptoms, the top 3 responses included the over-the-counter creams or lotion, false reminders, and dietary changes. And how well is that working? Sadly, over 90% indicated slightly effective to not effective, with only 7% of respondents getting any sort of relief. This is a sobering statistic and paints the picture of how under-recognized and untreated this condition really is. And here's a revealing stat. 68% of respondents said they've never even heard of the term chronic kidney disease-associated pruritus. This is surprising considering nearly half of respondents have proactively discussed their itching with their physician, but are still not being made aware of this debilitating condition. And finally, when asked if they'd be open to discussing a new treatment option with their doctor, one that could better control their itch, only 6% of respondents said no. I think this statistic demonstrates a call to action for physicians. Kidney patients suffering from moderate to severe itching want and deserve to be validated in what they are experiencing and diagnosed and treated appropriately with the latest FDA-approved treatment options. So, in conclusion, these responses speak volumes, highlighting just how common and disruptive CKD-AP is and how much unmet needs still exist. We're grateful to everyone who took the time to share their experiences. With that context in mind, let's turn to our speakers for a deeper look into what's being done and what's ahead. I'd like to welcome Dr. Tahas Desai. Dr. Desai is the Associate Medical Director for Cardiorenal Metabolic Diseases at CSL Vifor. He began his career in academic medicine, where he trained future doctors as co-director of the Internal Medicine Residency Program and led the Nephrology Fellowship at East Carolina University's Brody School of Medicine. He later joined the Department of Veteran Affairs, where he cared for veterans living with chronic kidney disease and end-stage kidney disease, deepening his firsthand understanding of the patient's journey. Today, in his role at CSL Vifor, Dr. Desai continues to lead medical strategies focused on improving outcomes for people living with kidney disease. Please join me in welcoming Dr. Desai.
Thank you. Thank you, Jerome. It's a pleasure to be here. Thanks to AAKP, and most importantly, thanks to the patients who not only are attending this call, patients and caregivers both, but as you'll see as we go through the slides, the patients who devoted their time to take the survey and provide us with this valuable information. So we'll talk about a study recently completed titled Chronic Kidney Disease-associated Pruritus, a patient survey. As many of you know, pruritus is the medical term for itching. And as you'll come to see early in this presentation and even throughout the presentation, the type of itching that hemodialysis patients can experience, especially those with CKD-aP, is far different than the type of itching a non-hemodialysis patient may experience. We'll talk more about some of those differences as we move along. So chronic kidney disease-associated pruritus can be local or generalized throughout the body, and it is itching that is related to one having kidney disease. It cannot be attributed to another condition, so it is considered a diagnosis of exclusion. You have to have identified the condition first and done a workup to determine if something else is causing it, and if nothing is found, then you're left with the diagnosis of CKD-aP. It is common, as you'll see momentarily, and it is a serious condition, as you can see from the pictures on your left. Those are excoriations and scratch marks from patients suffering with CKD-aP who cannot get relief from the pruritus that they are experiencing. It can affect patients on hemodialysis, up to 80% of patients on hemodialysis, and 40% of those patients will report moderate or severe itching. And that moderate or severe itching actually has some consequences downstream, which is the main crux of this scientific study that we'll review in a moment. So CKD-aP is associated with multiple adverse medical and psychosocial outcomes: poor quality in sleep, reduced quality of life, depression, missing dialysis sessions. You may ask yourself if there is an association between CKD-aP and these clinical outcomes. Why do we need another study that looks at CKD-aP and some of these outcomes? And the answer to that question is really the source of the data. So existing scientific knowledge in the body of literature has really relied on database data and data from electronic medical records to piece together what associations, if any, exist between CKD-aP and some of the quality of life conditions that you see on the screen. This particular study that we'll be discussing today has its data source being the patient. So this is an opportunity for patients to directly provide data vis-a-vis answering survey questions. And that's one of the key differences between previous existing data that associates CKD-AP with some of these conditions and the study that we're going to discuss now. So the study we're going to discuss is a patient survey. And it's often said that you want your healthcare provider to meet you as a patient where you are. But it's also very helpful if a patient, and in particular a group of patients, can meet the healthcare provider where he or she is. And that's one of the boons, the benefits of this particular scientific investigation. It takes a collection of patient voices and experiences as the direct source of the data, analyzes that data, and then interprets the data in a manner that physicians and nurse practitioners and other clinicians are accustomed to receiving, and then puts that information in an environment where physicians and clinicians are most likely to find it, which is the scientific literature. So this is a really good opportunity where the patients and the patient voice comes to the clinician and informs them of what patients are experiencing. So this particular study, we're going to look at 5 different aspects. We're going to look at the nature and the intensity of itching, and then we're going to go straight into how pruritus or itching or CKD-AP, these are interchangeable terms, how that affects different aspects of a patient's life and how that impacts the overall journey that a hemodialysis patient has who's enduring or suffering from CKD-AP. Patients are U.S. adult patients with end-stage renal disease. They're receiving in-center hemodialysis, and they have a diagnosis of CKD-AP, which I will explain on the next slide. The AAKP was instrumental in not just distributing the survey to the large members, but also in participating in study development, protocol development, and helping us analyze the data. So if it wasn't for the AAKP, a lot of this effort would have been not as fruitful as we'll see in the coming slides. 7,792 patients accessed the survey, but not all of them gave complete information. Not all of them had CKD-AP. And so in the end, we are presenting a study here of 354 patients who have CKD-AP. So on the left, you will see the 5 main categories that this particular study addresses. And on the right, you'll see different aspects of each of those categories. So up front, we'll talk about itch, pruritus, how we measure it, and what kinds of information we can glean from these survey instruments. One of the more common survey instruments that you'll find is here at the top, the modified WINRS score. It's a common patient survey that is used to determine if a patient has CKD-AP, and if so, to what degree. Yellow represents mild itch, orange represents moderate, and red represents severe. And this particular scale is modified because it represents, or it captures, one's itch over the last 28 days. The next 2 surveys, which also measure itch, provide more than just the itch magnitude. It tells you some other things about the itch. So for example, the 5D itch score that you'll see on the left looks at 5 different Ds: duration of itch, the degree of the itch, the direction of the itch, whether it is increasing, decreasing, fluctuating in its severity, the type of disability that one is or is not experiencing due to the itch, and the distribution of the itch. Is it general? Is it local? Is it jumping around from body part to body part? That's some of the additional granular information that you can get by using the 5D itch survey. And then you have the Self-Assessed Disease Severity Survey, SADS, on the right. And this is a survey that looks at your degree of bother. How much of a nuisance is this itch on your life? And there are three categories: never bothered, sometimes, and often bothered. So for the remainder of this presentation, we're going to be categorizing patients based on the WINRS. So patients will be either mild, moderate, or severe. And then we'll look at how that categorization of itch portends a particular prognosis for other aspects of one's life. This is a very interesting domain that the study looks at, which is how you interact with your healthcare team if you have CKD-AP. You'll see as we go through the results that there's a certain level of interaction that a patient and a healthcare provider has when it comes to diagnosing CKD-aP, talking about it, understanding the pathology of this condition, and then subsequently talking about treatment options and receiving treatment. So, 4 questions are asked here. Have you ever talked to your healthcare provider about itch? And who initiated this conversation? Did your healthcare provider diagnose CKD-aP? And did they inform you of the basic pathology of this form of pruritus, which is that it is related strongly to being a hemodialysis patient, that it is different in its manifestation than commonplace itching? And finally, did your HCP recommend any treatment? And then, if so, what type of treatment did you receive? For how long did you use it? And were you satisfied with what you used? Now, the remaining 3 domains go into the downstream effect of having CKD-aP. So first, we'll look at your hemodialysis treatment and how does itch affect receiving hemodialysis. Specifically, are you skipping dialysis because of pruritus? Are you shortening your dialysis treatment because of pruritus? And if you do either one of those things, is there another downstream consequence in that you must now have an extra dialysis session, one that was unscheduled and not anticipated as a result of skipping or shortening because of pruritus? There are a sizable percentage of dialysis patients who are gainfully employed, self-employed, or work for others, a friend, for example, or a relative. And we wanted to know if pruritus affects their ability to work. So there are 4 domains here within the work productivity domain. The first is absenteeism. Did you miss any work? The second is presenteeism, which means you were at work, but you weren't functioning at top peak level. And then the last 2 are just overall your productivity at work and your overall activity at work. And the last domain addressed by this study is really about your overall quality of life. And you'll see here that one of the survey instruments used at the top is called KDQOL, which is a common survey instrument that is administered to patients receiving in-center hemodialysis. You might remember this survey because it has a lot of questions, and some of these questions are related to your overall health or your kidney health, things that happen in your daily life, in your sleep. And people, like the investigators of this study, pay attention to those answers that you give to your healthcare provider. And then there's another survey that specifically looks at sleep. And you'll understand more as we get to that slide when we look at the results. It's called a brief itching inventory, and it pairs the degree of pruritus that one experiences with its effect on their sleep in the last 24 hours. All right, so the characteristics of the survey respondents, you can see it here both on the left and on the right. And what I want to call your attention to actually are the last 2 boxes. So the time on hemodialysis and the itch duration. The median time on hemodialysis for a patient who is suffering with CKD-aP is measured on a scale of years, not on a scale that's shorter than years. And so this is not a condition that afflicts primarily new dialysis patients. These are often considered well-established dialysis patients who are now afflicted with CKD-aP. And the next box, the last box, is the duration of it. So again, you'll see this is measured on a time scale of years and not on any time scale less than years. The median is 2.1 years. So patients who are seasoned, more experienced in receiving dialysis will be afflicted with this burden on average, a median of 2 years or more. Something to consider. And then on the right, you'll see the distribution of the patients. So this is based on the WINRS scale. About 50% had moderate, and the balance remaining either had severe or mild CKD-aP. So the first domain, the measures of itch. So take a look at the graphs at the bottom of the screen. We'll look at the 5D itch graph, which is on the center of the screen first. The x-axis represents the severity of itch based on the WINRS scale, mild, moderate, or severe. And then the y-axis shows you their 5D itch score, measured on a scale of 5, where you have no itch, to a max of 25, where you have the severest amount of itch. And there's a nice linear trend between the WI-NRS score that measures itch and the 5D itch score. Now that's important because not all patients and not all providers will use both scales to identify CKD-aP and then to quantify its degree of severity. So it's good to know that whether you have a provider that favors one scale or another, that they're likely to get congruent information independent of which scale they use and which one they choose not to. On the right, you see something similar. So again, the x-axis represents your severity of CKD-aP as measured by the WI-NRS scale. And the y-axis represents the percent of participants who scored type A, B, or C. Never bothered, sometimes bothered, or often bothered. You'll note on the severe end of the scale that more patients are sometimes bothered or often bothered than are never bothered from their pruritus. And that may not be a surprise to you. What may come as a surprise to some folks is what happens on the left, the mild part of the scale. So patients with mild CKD-aP still have some degree of bothersome symptoms affecting their life as a result of the itch. More than 50% report some bother from their pruritus, even though they're reporting that their pruritus is mild. Now we look at healthcare provider interaction. So let's look at the first row. Have you ever spoken to your healthcare provider about itchy skin? And you'll note that in the mild category, just over 50% of the patients have spoken to their provider about having pruritus. And the balance either didn't speak to their provider or can't remember. Understandable. Now take a look at this last circle, which is severe. More than 75% of the patients who have severe pruritus have had a conversation about it with their healthcare provider. But it's not 100%. So less than 25%, maybe approximately 25%, somewhere between 20 and 25%, don't remember that they had a conversation or didn't have one at all. And so one can be surprised from that information that a patient who has severe CKD-aP has a particular probability of not having a conversation with their healthcare provider. In the next row, you'll see who started the discussion of CKD-aP. And overwhelmingly, it is not the healthcare provider that starts the discussion. It is more likely than not the patient or someone on the patient's team helping them manage dialysis and other complications from kidney failure. So it really isn't the healthcare provider. Was treatment recommended? So of course you have to have a conversation with your provider first before anyone can recommend treatment. And when that conversation happens, only 55% of the time, some treatment is recommended. The remainder of the time, 45%, the patient either doesn't remember what the treatment is or no treatment was recommended. And then you can see at the last row, the different types of treatments are used. And in 75% of the cases, some kind of topical ointment or lotion is recommended. And then you can see the rest of the percentages down below. So the next three domains are really about the consequences of this itch and how it affects a patient. In this section, we're going to talk about the effect that itch has on a patient's hemodialysis treatment. The first pair of graphs look at the percentage of patients who shorten their treatment or skip their treatment because they have itch and breaks it down based on how severe the itch is. The second pair on the right talk about that consequence of shortening or skipping a treatment. Basically, do you need another treatment that is often unanticipated and not scheduled because you shortened or skipped, because you suffered from itch? So let's take a look at the first pair. Again, the x-axis is broken down by itch severity, mild, moderate, or severe. And you'll see green bars, purple, yellow, and red. Green means that you have never had this outcome, never shortened dialysis or never skipped dialysis. And then every other color suggests that you may have had this outcome to a different degree. And of course, the severe patients in both the shortened case and the skipping case are more likely to have had the outcome of shortening or skipping than the mild patients. But it is interesting to see that even if you have mild CKD-aP, there is still some percentage of patients who shorten their dialysis as a result of it or skip. And then when you go to the right pair, did you receive an extra treatment, unscheduled, unanticipated, because you shortened your session? And you can see that the green bar, which would say you never received an unscheduled session of dialysis, does not approach 100%, and in most cases doesn't approach 50%. So there is a consequence to having shortened dialysis session because of itch, almost independent of what severity of itch you experience. Work productivity. And so what you see here on the x-axis now is the different categories of work. Absenteeism means you couldn't go to work. Presenteeism means you were at work, physically present, but unable to perform the tasks at the highest level or a level to which you are accustomed or expected. Your overall work impairment and your overall activity at work. And perhaps unsurprisingly, as a patient suffers from CKD-aP and the severity increases, the rate of absenteeism increases, the rate of presenteeism increases, the rate of everything goes in the wrong direction as your CKD-aP becomes more and more severe. It is interesting to note that even if you have mild CKD-aP, you still have some form of work impairment. It is not near zero. And the last domain that is assessed is the overall quality of life. In the middle of the screen, you'll see the KDQOL. That's the survey with which many of you are familiar. And you'll see a heat map. So I'd like to orient you to the heat map and then call out some findings that you may find interesting. First, the heat map goes from a scale of green to red. Green means that you're faring better. Red means that you're faring worse. And yellow means that you're either indeterminate. You can go in either direction. Now look at the columns on the x-axis. You then see mild, moderate, and severe. So mild represents mild pruritus based on WINRS. Severe, same. If you look at that first column, you would expect that most of the boxes would be green. And indeed, most of the boxes are green or some shade of green. But there are some boxes that are, in my humble opinion, objectively not green. For example, the third, burden of kidney disease, that's not green, that's in the orange spectrum to me. Your work status, also in the orange spectrum. And sleep, in the yellow spectrum, indifferent. So at a mild level of CKD-aP, you are already seeing some effects on one's quality of life. And then as you progress from mild to moderate to severe, not only do you see a worsening of those three aspects of one's life, but you see the green shades moving towards the yellow and the red end of the spectrum. Now, if we look specifically at one of the elements of quality of life, which is sleep, we'll turn our attention to the graph on the right, which is the brief itching inventory. And it correlates the degree of pruritus that one is experiencing with sleep disturbance in the last 24 hours. Again, the x-axis shows mild, moderate, and severe based on WINRS, and the sleep score is on the y-axis. And as you see, as the CKD-aP worsens in its severity, the sleep disturbance worsens in the last 24 hours. Notably, there is sleep disturbance that patients experience even if they have mild CKD-aP. All right, so we're coming to the end, and you can see the takeaways from the study. These are certainly not all the takeaways. These are takeaways that I thought were most important to patients based on patient interviews and my experience treating patients. You may take away something different, and that's totally fine. What I want to call your attention to is the bottom row, which are the study limitations. All studies have limitations, whether they're surveys, whether they're clinical investigations, whether the trial design is of one way or another. All scientific studies have limitations. So it's important for you to know what some of the limitations are, and more limitations are iterated in the paper itself. And then you have to, of course, gauge whether those limitations are consequential enough that you would discount the information presented in the scientific manuscript, or whether they're not consequential enough and that you can take that information and then speak with your provider or take another action based on that information that you read. So I want to thank Jerome, the entire team at AAKP, with whom I've had the pleasure of working with for, I guess, the better part of a decade and a half now, all of the patients who took the survey and really made an effort to bring the voice of the patient to the doorstep of the clinician through the scientific process and through scientific study, and everyone that's on the call today. Thank you very much.
And Dr. Desai, thank you for your insightful presentation and for shedding light on such an often overlooked condition. We appreciate your time, your expertise, and your commitment to improving care and quality of life for patients. And again, thank you for joining us. I'm excited to introduce our next speaker, Dewan Hatish, an AAKP International Ambassador from India. Dewan is a filmmaker, author, and former engineer whose life took a dramatic turn in 2022 when he was diagnosed with renal failure. During the shoot of his short film, Bharat, he suffered a heart attack, developed fluid in his lungs, and began emergency dialysis, all in the span of a few days. Despite the challenges, Dewan completed Bharat, which went on to earn over 2 million views on YouTube and recognition at several film festivals. Since then, he's explored alternative therapies, challenged common assumptions about kidney disease, and openly shared his journey. Now awaiting a kidney transplant, Dewan continues to write, create, and inspire others with his story. Please welcome Dewan Hatish to our program. How you doing, sir?
Hi, thank you so much for having me. I'm doing great. How are you?
Good. Good. Thank you for being with us. Can you share what your experience with itching has been like? When did it start? How has it changed over time?
Yeah, so it's been 3 years since I'm on dialysis, and the itching started in the first year. And initially, it was bearable, but as the years passed on, it became a little severe. And how it has changed, I mean, I'm getting used to it, and I'm taking proper medication. It happens because of electrolytes disimbalances in the body. So I keep a track on my electrolytes and take proper medication, and now I'm used to it. So the severe pain is still there, but uh, I am I have I'm getting used to it day by day. Yeah.
How does the itching affect your day-to-day life, including like sleep, your mood, activities that you enjoy?
Yeah, so dialysis is a 4 hour process for me, and again, it depends from patient to patient. So the itching starts somewhere around in the first hour, and then it continues throughout dialysis. After dialysis, I usually take a 4 hour nap, and the itching stops in 3 to 4 hours. During that time, it really does affects my sleep, and because it's very difficult to sleep because the itching doesn't go away by scratching, or neither does it go away immediately. It slowly burns down, and yeah, and it also affects my mood. It's very irritating. It's like somebody's poking needles in your body. It happens at random places, on the face, on the legs, and all over the body. So it's very difficult to explain to other people. And yeah, and even and it depends on from patient to patient. Since now I'm getting used to it, after 3 hours of those the itching, I take a good nap, I take good sleep, and I take proper medication, and then it goes away slowly.
When you first mentioned the itching to your care team, how did they respond? Did you feel heard?
Yeah, so initially I had two care teams. One was following a natural therapy, and the other was the normal nephrology team. The natural therapy recommended oil massages and different other therapies, which sometimes worked and sometimes didn't work. And my second team, which was my main team, my nephrologist, they suggested proper medication because the levels of phosphates in my body had increased drastically. So to lower them down, dialysis machine is incompatible. I mean, it cannot remove phosphates from your body. It can remove other electrolytes like potassium, etc., but not calcium and phosphates. So for that, I had to take calcium medicine, and other medicines like sevelamer, which really helped a lot.
Have you ever felt like your symptoms were dismissed or misunderstood? And if so, how did you handle that?
Yeah, so when you tell somebody it's itching, they don't really understand. So I mean, because for lack of a better word, we don't have a better word for it. So and I didn't knew what it was called. So it doesn't go away by scratching, as I said before. So my natural care team told me that it will go away by oiling your body, or they gave me a cream which did not work. So later on I learned that it's not really an itch; it's a problem because of excess phosphates in the body. So yeah, that was the only problem with it. And then when I took proper medication, like a weekly dose of uh, sevelamer or phosphine tablets, it went away.
So, what would you say to another patient who's just starting to experience this kind of itching?
So it depends from patient to patient. I'll tell you what worked for me. I'd suggest that it's nothing to be afraid of, first of all. I do regular checkups. I do monthly checkups for my electrolytes along with CBC and KFT blood tests. And if my phosphate levels are high, I take a 1 week course of medicines like phosphate or sevelamer or whatever is available in your country. You can consult your nephrologist and work with them. And I think you'll be good to go.
All right, Dewan, thank you for sharing your kidney journey and your experience of managing CKD-AP. Your openness and willingness to share your story with us is truly appreciated. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. In closing, if you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As a member of AAKP, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download. I also encourage you to visit the website showing now on your screen, bit.ly/stop the itch. That includes all of our National Itch Day materials, including our pocket guide to managing CKD-AP and patient stories of managing CKD-AP. Looking ahead, we are excited to announce the dates for our 2025 AAKP signature events. The 8th annual AAKP Public Policy Summit is taking place June 27th at the National Press Club in Washington, D.C. There is both an in-person and virtual option available. Registration is free and is now open. And the 50th annual AAKP National Patient Meeting is taking place October 3rd through the 5th, 2025 in Fort Worth, Texas. This year's event will be a hybrid event with in-person and virtual options for attendees. Join us as we celebrate this event's golden anniversary. Registration and housing will be open soon. Additionally, don't forget to visit our AAKP On Demand webpage at bit.ly/AAKP On Demand to watch inspiring presentations from 2024 and upcoming 2025 events, and explore even more great educational content on our AAKP YouTube channel at bit.ly/AAKP YouTube. We would like to extend a heartfelt thank you to our webinar speakers, Dr. Tejas Desai and Dewan Hetish, for graciously participating in today's Healthline event. Their expertise and insights greatly enriched the discussion and provided valuable information. We also want to express our gratitude to all who joined us. Please share what you learned with others. Thank you again for joining. We look forward to you joining us for another great Healthline event.